asked you to do pelvic floor exercises? In today's video, we are going to learn how to do Kegel exercises. This is Dr. Amruta Inamdar. I am a pelvic floor rehabilitation specialist and I'm going to teach you pelvic floor strengthening exercises, also called as Kegel exercises. The easiest way to locate your pelvic floor is by sitting on an exercise ball, just like this. Once you sit on the exercise ball, I want you to make sure that you have a slight curve in your low back. Now keep one hand under each of your sit bones and move from side to side. The muscle between your two hands is actually your pelvic floor muscle. We are going to learn how exactly to strengthen this muscle that is located in between your two hands. In the beginning, pelvic floor strengthening could honestly be very difficult or frustrating. It is therefore very important to know what positions to start in order to do a correct Kegel routine. I recommend 3 very easy but effective exercise positions in which your pelvic floor muscles can be easily isolated. The first is supine or lying down on your back. The second position is sitting up on an exercise ball, just like this. You could also choose to lie down on your side with a comfortable pillow so that your body is well aligned and you're not fighting gravity, just like this. I want you to try each of these 3 positions and then decide what position suits you best, in which you are able to feel the pelvic floor muscles easily and more effectively. Now that you have chosen the appropriate position for Kegel exercises, we are now going to learn how to do a Kegel in 3 easy steps. In the first step, I'm going to ask you to be aware of your rectal opening. Try to squeeze the muscles gently, as if you're trying to avoid passing gas through the opening. This is the posterior or the back part of your pelvic floor. You have to, however, remember that when you do this, you are not supposed to squeeze your gluteal muscles. For example, when you're sitting on a ball and trying to do the rectal muscle contraction, you have to make sure that you don't do upward movement because of your glute squeezing. This could be a little hard in the beginning, but with practice, this does get easier. Remember, the posterior muscle contraction is just closure and lift of your rectal opening without the use of your gluteal muscles. In step 2, we are going to try and locate the muscles around your vaginal opening. The way you do it is try and imagining there's a string that is pulling your vaginal opening up. This is the easiest way to visualize your vaginal muscles working. So in step 2, you are going to practice vaginal muscle closing. So you are going to not only close the vaginal opening but also try and lift. In the beginning, it could be hard to locate this muscle, so I would encourage the easiest position to start with is lying down. Once you get the hang of your first Kegel, it gets easier and easier to train the rest of the muscles. Okay, so now that you know step 1 and step 2, let's combine it in the final step. That will actually be your Kegel. In your third step, you're going to try and isolate your rectal muscles and your vaginal muscles together. Imagine there's a cord or a string that's pulling your pelvic floor up and then slowly let go. You have to make sure that your pelvic floor muscles do not get masked by bigger muscles like your abdominals and your gluteal muscles, especially in the beginning. While doing your Kegel exercises, there are 2 cues that I use often which are very effective with my patients in the clinic. One is to imagine that you are trying to stop your urine midstream. That is exactly and precisely the way your pelvic floor muscles work. Second cue is to try and lift like a little structure like a blueberry up into the vaginal cavity and then slowly release the blueberry down. These are the 2 cues that I find are very effective clinically. There are a few words of caution that I would like to extend as you start your journey with the Kegel exercising. The first and the most important caution is do not use stopping of urine midstream as a form of Kegel exercise, as that could really interfere with your brain and your pelvic floor connection. Secondly, it is very important to get evaluated in person by a pelvic floor physical therapist to accurately know whether Kegel exercises are even recommended for you. Thirdly, if you are experiencing painful urination, incomplete emptying, and symptoms like pain with sexual intercourse, most likely Kegels are not the right exercise for you. So, getting evaluated is very important before you start your Kegel exercises. So here you go. You have the basic and the necessary knowledge to start doing a Kegel routine all by yourself in a correct way. If you like this video and find it helpful, don't hesitate to share it with your friends. Give us a thumbs up and subscribe to our channel. I hope to do a new video every week, so you would be the first one to get notified once you subscribe to my channel, Pelvic Rehab Doc. See you in the next video soon. To your better health, Dr. Amruta Inamdar.